Key concepts in mentoring will be given by Dr. Calvin Thigpen. Dr. Thigpen is Associate Professor of Internal Medicine, Division of General Internal Medicine, and Associate Residency Director at the University of Mississippi Medical Center. He and I have worked together for, God, it's got to be 12 years by now. And both of us have very similar interests in growing careers of young professionals. And he's going to be giving this talk on concepts in mentoring.
Thank you, Dr. Geraci. Dr. Geraci is a mentor of mine, and I have to give him a lot of credit for a lot of the material that's going to be in this talk. About a year ago, in the Medical Education Symposium in the AJMS, there was an article about a review of mentoring in academic medicine that he and I co-authored. So if you have read that, you'll recognize a lot of this. If you've not, this might prompt you to go back and read it as well. So at the beginning, I'm going to start off just by asking if someone in the room would share a positive experience that you have had with mentoring, where you were either the mentor or the mentee. One of the jobs that I have right now actually is working with the American College of Physicians, and there is a former governor of our chapter, and that's the role that I'm in right now, has been a great mentor to me, and he actually never taught me a single bit of medical knowledge at all. But what he has taught me actually is a lot about being a leader and how to really step out and speak up for what you feel is the right thing to do. And I've actually had a chance to watch him do that, not just directly when he was the governor himself, but actually indirectly, and just watching how he communicates with other people and just how he responds to communication that I deliver. Very rewarding, and I think really it illustrated to me what I think is important and maybe not overtly said enough on these slides, is that there's not going to be one person that is your single mentor. There are going to be people throughout your career that are going to serve as mentors in lots of different ways. You might go to someone as a mentor that will help you with academic advancement, and a totally different person who's going to help you as a mentor for your work-life balance, who might have some things in common with you in that respect. So I'm going to pop up a few examples of famous mentor-mentee relationships. You probably recognize those two people, Oprah Winfrey and Maya Angelou. You might not recognize those two that preceded our time by a long way, Ralph Waldo Emerson and Henry David Thoreau. You might recognize those two people as well. Mark Zuckerberg on the right with Facebook, and Steve Jobs on the left with Apple. And Woody Guthrie, Bob Dylan, also a mentor-mentee relationship. And then an interesting mentor-mentee relationship that actually started off very well, and I guess in the public has not been harmonious throughout. There is the possibility that if that a mentor-mentee relationship can actually go sour, and it really, a lot of how well the relationship functions does depend on both people, with the mentee often being the one who drives the relationship, actually, because the mentee being the one who has the needs, although the mentor does often get a lot out of the relationship too, of course. All right, so here are our objectives, what we're going to talk about over the next 25 minutes. And we'll start off by just understanding what is mentoring to begin with. What is the actual definition? Is there a good definition of what a mentor is? And really, it can get confusing. There are a lot of different things that we hear, and we kind of say, well, that sounds a lot like mentoring to me. Coaching has been in the literature a lot over the past couple of years, especially as physicians have been dealing with burnout and dealing with all the pressures of their job, outside of their job as well. And coaching in the sense of there's clinical coaching and there's coaching about work-life balance. But really, when I hear the word coaching, I think about someone who's trying to get the most out of me, but also is allowing me to drive to realize that myself. However, it doesn't really cover a lot of other things that mentoring might. Advising is another that we often hear about. Teaching. We can think of great teachers that we've had. Maybe they weren't necessarily mentors for us, but we might just call them mentors even though they were really just teachers. Tutoring, where there was a one-on-one relationship where a specific skill was being taught or remediation was being done. Advocacy, where there might be a person who went and spoke on your behalf to the institution to try to get something for you that you would not have been able to get yourself. Role modeling, where there was just someone who was a great example to you on how to live out their life, whether at work or at home. And sponsorship, where someone actually has gone to the level of providing you materials to allow you to do your job better. I don't know if any of you have seen this book, or some of you, I'm sure, know who Tony Dungy is. He was a football coach of the Tampa Bay Buccaneers and then the Indianapolis Colts. He was with the Colts when Peyton Manning was there. He now is on television every Sunday night on Sunday Night Football. He wrote this book called The Mentor Leader, and actually it has absolutely nothing to do with medicine. But I think it is a fantastic book in describing the role of a leader as a mentor, and it does really encompass all of these things that are up here on the screen. And that's really what mentoring is that it's really more than all of those things individually are even. It's typically a longer term and a deeper relationship. Sorry that a little bit of that got cut off. But support and encouragement is, of course, involved in the relationship. And it's really all about personal development, but really in a deeper and much more and longer term way, typically, than each of those other individual roles. Usually, the mentor is not in some sort of hierarchy. So it might be the case for you that your division director or your department chair winds up being a mentor for you. But as you know, that can actually get a little bit tricky. That's where there is the possibility of that relationship going sour if there is some need that, say, the department has and that you get asked to do, but you feel like you have to say no to this. It doesn't fit with your career development plan, and you can imagine how there's the possibility that could be taken personally, and it could affect a mentor-mentee relationship if one existed there. So usually, it's actually not someone who is in that supervisory hierarchy. It's actually someone who has been down that road that you're traveling right now, in whatever respect that it is, and someone usually senior to you. If not senior in age, at least senior in experience in that area. The values are similar or are aligned, and the long-term goals that person might have had before are now your long-term goals as well, and your personalities tend to match up. So, and I apologize again about the cutoff. I think my screen was different than the one that's on right now. But so we kind of have an idea, and I say kind of we have an idea of what mentoring is. It's really all of those individual things together, plus a deeper and longer term commitment usually. So there are lots of different types of mentoring. You have probably been exposed to many of these. If you've been to many meetings like this one, or if you've been to national meetings, I'm involved with the Alliance for Academic Internal Medicine. Every single time that there is a meeting, there is an opportunity to have a mentor at the meeting. And I just got through describing mentoring as being something longer term. Obviously, if you're only meeting at the meeting, that's going to wind up probably not really being a mentor-mentee relationship. But it's described as mentoring because it gives that opportunity for this to become a longer term relationship. What we are most familiar with is what is most oftenly offered at a meeting, or offered not just at that meeting, but an opportunity to start at that meeting, is one-on-one mentoring, a dyadic relationship. And the second thing listed up there on the screen, the multiple dyadic mentoring, actually is what a lot of us probably have experienced when you have multiple mentors, different one-on-one relationships. Then there's also team mentoring or panel mentoring. They do that at the meeting that's going on right next door at the southern region of the Society of General Internal Medicine meeting. You can have distance mentoring, and then there are others. So functional mentoring is really centered around one particular thing that is trying to be accomplished. There is facilitated peer mentoring. That's actually similar to what I've described about that occurs at a lot of meetings. Speed mentoring, and it's actually what's photographed here. So you have probably heard of this as well. Just to me, that doesn't really get across that idea of a longer-term relationship, but going from one table to the next in a very rapid fashion, getting exposed to people who might be coming at a challenge that you're facing from a different angle. And there's the opportunity of developing a longer-term relationship with any one of those conversations. Formal mentoring and informal mentoring. So, you might have a mentor where you, on a schedule, practically, the mentee prefers, I would like to meet quarterly. Or informal mentoring where you're going to be seeing this person regularly, and when that opportunity arises where you need some advice, then you have a chance to meet. And then, of course, assigned versus voluntary. So lots of different types of mentoring in particular. So what I'm going to focus on mostly for the rest of this talk is that dyadic relationship, that one-on-one mentoring. So what makes a quality mentor? I think we all also have this kind of general idea of, what is a mentor, what would a mentor be like, a good one? But we're going to talk a little bit more specifically about several characteristics that a good quality mentor would have. First, the relationship is going to fail if the mentor is not truly committed to the mentee's success. If that's not there, eventually the mentee is going to bail out on the relationship, and they might just stop contacting the mentor if they realize that this person is actually not interested in me, really. The mentor really has got to be trustworthy. There are a lot of things that are going to, and have respect for the mentee, a lot of things that are going to be said that are confidential, that the mentee really doesn't want anyone else to know, and they're asking for some advice, and they're putting a lot of trust in the person they're talking to, and if they hear later on that some of that information comes back to them through another person, that is likely also to be the end of the relationship there, or at least on the level of mentor-mentee. And I put this book over here on the side. It's actually not one of those books that probably pops up a lot when and talks about character and integrity, even though the title was integrity. But if my personal feeling after reading this book is that anyone who assumes a role of leadership in any respect, whether it's leading a relationship like a mentor-mentee relationship or otherwise, should read this book by Henry Cloud about integrity and talking about the 6 components of integrity. It's fantastic. We actually have had our chief residents read it. We actually even had a book club at our institution with the chief residents and the program leadership, and fantastic book. And it talks a lot of what is mentioned in this book really hits home about things that make someone a good mentor. Other things that other characteristics that a mentor has. A good mentor usually engages in self-reflection on a regular basis. And that's important because a big part of what the mentor is doing is they're going to get the mentee also to engage in self-reflection. So if the mentor doesn't do this on a regular basis, they're not going to be able to provide that direction for the mentee. A mentor also can provide emotional support at times. And this is where I think the idea of having more than one mentor is a good thing, because you're going to need, as a mentee, you would need emotional support at work for some things, and that's a very different kind of emotional support than you might need in another part of your life. But a mentor does provide emotional support typically because, as we all know, your career is not going to be linear. There are going to be ups, and there are going to be really big downs a lot of times. So your mentor needs to be one who can provide that kind of emotional support. This last thing that is listed up here, we talked about this yesterday about active listening when we were talking about balancing teaching and patient care delivery at the same time. But active listening is, and we're going to touch on it again on a slide near the end of this talk, active listening also is absolutely essential for the relationship. A mentor really, in these conversations that take place with a mentee, needs to be fully engaged, be ready to respond, be looking for things that might not be said, but that might be nonverbal cues, not distracted by other things. And that's important. If you're a mentor already and you set up a time to meet with your mentee, that it's a time when you can ignore your telephone and ignore other things that might be going on, at least for a while. And if you feel like that won't be the case, or that it's going to be a narrow time, that the mentor really should say it up front. Say, okay, well, I've got 20 minutes or I've got 30 minutes that I can provide for you at this time, because the mentee really needs to feel that the mentor is actually hearing and taking in all the information that's there. Some other characteristics of a mentor. So, it is for all of us, I think, and the best correlation to make with this might be to think about rounding, and you're the attending, and your resident or your student, or if you're in training still right now, and the student is telling you about what they want to do, or telling you about a patient, and your tendency to want to jump in and just tell them what to do and tell them what it wasn't right about that and how to fix it. And the same thing goes really for, you really want to fight that, because the student or the resident needs to learn, be able to make decisions on their own and be able to learn from that. A mentor really needs to be able to fight that same tendency too, and not dictate what should happen next. So the mentee might describe a situation, and the mentor is sitting there thinking, I have had this exact same thing happen to me. many times before, let me tell you what you got to do right now. That really can't, if that were to happen, it doesn't really help the development of the mentee. The idea really is to guide and let the mentee get there, a lot of that way on their own and not dictate what's supposed to happen. The mentor, to really be effective too, needs to have a lot of knowledge about that area where they are mentoring. So it really wouldn't make a whole lot of sense for a cardiology fellow to have as a mentor about how to get a starting faculty position at a prestigious cardiology institute to go to the oncologist on faculty and ask them questions about that. The oncologist is probably not going to be able to provide them the key contacts that they might need or the networking they might need to be able to potentially get that position or to be able to advocate for them. So really having knowledge that field, that area, or that specific institution is very, very valuable. Also, honest feedback, and I have to, it is difficult, even when we have an experience clinically with learners, to give honest feedback sometimes. But if you have done it, even in that setting, you know that the feedback might be difficult for the listener to take in initially. But almost invariably, at some point, whether it's during the conversation, 5 hours later, 5 days later, 5 years later, that person is really grateful that you were very honest with them about something that they needed feedback on. So a mentor really standing outside, hearing about what's going on with the mentee and being able to hold up that mirror for them and give the mentee some feedback is just invaluable. It really is invaluable. And then once you do that, the mentee knows anytime I get to a situation where I really need someone to be honest with me, I can go back to this person and they're going to tell me exactly what they think about what I'm describing when I ask them to do so. They're not going to soft pedal it, there is a bit of a line to walk, and sometimes brutal honesty can be too brutal, but honesty is very important. All right, so those are some characteristics of a quality mentor. What does a mentor actually do? And there is a little bit of overlap here. As we talked about some of those characteristics, we talked about some of the things that a mentor does. But specifically, often a mentee, and Dr. Geraci touched on this earlier during his talk, when he was talking about setting up the mentoring committees at the institution. I was actually at that institution, and I was on one of those mentoring committees. It's true. At our institution, most of the people who were being mentored, most of the mentees had not reviewed, didn't have any kind of career development plan. They had nobody that really was there so far to help mentor them. And you also talked about this yesterday. They had not reviewed their contract even, so you could tell there wasn't really a vision out there that this individual had. That a mentor can actually help provide that vision, not give the mentee the vision, but encourage the mentee to look at things long range. Where is it that you want to be 2 years from now, 5 years from now, 10 years from now? And if you take this job, what is it going to do to those goals down the line? So a mentor can certainly help provide vision when it's not there, or encourage the mentee to develop a vision. And I mentioned earlier that the mentor really should be one who engages in self-reflection so that that person can assist the mentee in reflection. The mentor also helps keep parties accountable. So I'm a terrible procrastinator, really bad procrastinator. And I think, honestly, I believe that that's really a trait in a lot of internists, is we are procrastinators. And deadlines, it is very helpful for someone to say, you said this was going to be done by this time. It's now, we're 2 weeks away from that time. Where do you stand right now? Let's hold each other accountable. That's very, very valuable and something that a mentor should do. I don't know if you recognize the two people that are down here. Number 10 is very familiar to me. He was a quarterback at Ole Miss. That's where I went to undergrad. It's Eli Manning, still playing in the NFL. Was with the Giants this year, maybe still again next year. I don't know if you recognize the person on the left, though. That's Kurt Warner. He's actually not famous for the time that he was playing for the Giants. He's famous for when he was playing quarterback for the St. Louis Rams. They were the St. Louis Rams at the time, and then for the Arizona Cardinals, and won the Super Bowl, was a Super Bowl MVP. So between those times, the Rams and the Cardinals, he was at the New York Giants in Eli Manning's rookie year, and they put him out on the field because Eli Manning was struggling badly. Played a couple of games. He actually played quite well, and then he went and told the Giants organization, "You need to stop playing me. You've got this guy here who's the future. I don't really fit with this offense, but I'm glad to mentor him." And which really is a fascinating story. It's a really great example of someone advocating for the mentee in a place where you never see that, professional football really, or you very rarely see it between two players. But it's a good example of what a mentor might do for someone in medicine in their careers, advocate for them. Go to the leadership and say, "You've got somebody here with great potential. I think they're very capable of doing this job. This person might be the future for you in this role." And that's exactly what happened here. He was the future. And that mentor possesses knowledge and skills that usually they could pass on to the mentee. Other things that the mentor does, typically, and this one is rather obvious, advises the mentee, protects the mentee. So there are lots of things that decisions that you have to make, things that come along in your career where there's the real opportunity that this one decision or this one change or this one opportunity actually could wind up derailing what you would like to see happen with your career later. And a good mentor will typically step in and protect the mentee in that situation. Sometimes just by giving advice. Sometimes might even go on the mentee's behalf to the person who offered the opportunity and say, "Maybe you should think about someone else in this role, because I think the person you've asked might be better suited elsewhere." The mentor will often provide sponsorship. We mentioned that earlier, just with acquiring materials that might be helpful to the mentee. And then, as we've touched on a couple of times, the mentor typically possesses knowledge and skills that help meet the mentee's needs. So I put Kevin Costner up here as the bodyguard. You might have seen that movie. That's not necessarily the idea that the mentor is the bodyguard, but the protection is definitely the same type of idea. All right, so how about in one encounter? So we talked about, generally speaking, what does the mentor do? And I mentioned this a little bit earlier about when it comes to active listening. But these are all the things that can happen in one encounter. That's a lot listed up there. And the one that I've had the opportunity to mentor several residents and a few young faculty, especially in the last couple of years, and I have a lot of things going on typically at one time, like all of us do, really, right? You have a lot of activities that you're involved in, things that might be going on at home, whatnot. Is doing this, turning off the background conversation in your head, is very difficult to do. But really, it should be the thing that you remind yourself to do before you begin one encounter with your mentee. And then the obvious is to stop talking and to listen for a while. Now, there's going to definitely be an opportunity as a mentor where you really do need to talk. But to actively listen is a priority, and to turn off all the other noise that might be going on inside of your head. And I mentioned nonverbals as well. The longer that relationship goes, and this is where mentoring relationship can be so valuable, is that the longer it goes, the better the mentor gets at noticing nonverbals. Noticing when the mentee doesn't say what, because honestly the mentee might be worried about the reaction of the mentor in some way, or feel a little bit of, I know that I shouldn't have done this. I know that my mentor has told me many times not to do this. But a good mentor will be able to recognize those nonverbals after a longer relationship. All right, so in summary, we've talked about mentoring and what it implies, a deeper, longer term relationship, and what all it includes: the coaching, teaching, tutoring, advocacy, sponsorship, role modeling, all of those. We talked about the different types of mentoring that exist, and the most common one being the dyadic one-on-one relationship. We talked about the qualities and characteristics that a mentor has, and then all of the things that a mentor does. And just again, keep in mind, you will not have just one mentor. You will not be the mentor, the one sole mentor. And I really encourage you, when you get opportunities to mentor, and I tell this to our residents a lot, because they are really, and there is a bit of a hierarchy there as their associate program director. So I definitely want to make sure that they know that even when we sit down and we do a semi-annual evaluation, and there is certainly mentoring in some form that goes on in that setting, as I tell them, to seek out people other people and usually guide them maybe to a person that can be a good mentor for them, to seek out multiple other people, both inside the institution and outside the institution too, because so much perspective can be gained from outside, for them to seek out those people to be mentors in their lives. So with that, absolutely. All right, thank you.